Hi, I'm Saj Bob, one of the respiratory therapists at Morlen Health.
And I'm another respiratory therapist, Ed Birnbaum, with Morlen Health home-based pulmonary rehabilitation program.
The topic for Breathe Better 101 is irritants, and it's part of the pulmonary rehab educational series. The objectives of today's topic, to discuss the possible irritants to a person with chronic lung disease, what can cause flare-ups and how to avoid them, what to do during a flare-up, when to seek medical attention, and how to stay healthy during flu season. So know your personal respiratory irritants. Smoking can be one of the irritants, or being someone around who smokes, or being around a fire, or if somebody has a bonfire sometimes outside, that can be an irritant. Infections such as the cold or flu can be an irritant. Strong fumes or perfumes or scents, candles, uh, incense, air pollution, weather changes, very cold or very humid air, and stress and anxiety.
Right. Everybody has their own set of irritants. They can overlap with these, but usually fall into one of these categories.
Keeping a flare-ups diary. So when were you when your symptoms got worse, or where were you when your symptoms got worse? What were you doing when your symptoms got worse? What were your symptoms that got worse? Were there any new symptoms, and what did you do to reduce your symptoms, and what can you do to avoid this irritant in the future? Basically, what this is trying to uh, make a point of is that everybody's symptoms can be different, and the causes of the flare-ups can be different as well. So if there's something that are known, so if you know you're allergic to a cat or smoke, then you know when you're going to somebody's house with a cat, maybe you got to stay there for only a few minutes or pre-medicate. If you know you're going to somebody's house where they have a log fireplace, a real fireplace, you have to ask them not to have a fire because that smoke sets you off. So if you know those, you probably don't have to keep a diary about it. But if there's something new that's caught you off guard or it's unusual, try to remember to write that down. Text yourself, send yourself an email, ask somebody else to remember for you or to remember this, and see if there's something that you can trace back to what it was that might have set you off. It could be a new cleaning solution. It could be you rode in a car with somebody who did smoke, and you didn't think that a little bit of the smoke was a big issue, but that actually set you off. Maybe somebody likes to burn a certain type of candle that sets you off, but you weren't aware of it before because it's new to you. So just keep a diary if there's something that new that can cause a flare up.
Right, right. So it's the point isn't to be spending all your life just focusing on what makes you feel worse, but enough to you just even if it's a few seconds a day or at the time when something's going on, so that you can catch something in the bud, before it gets worse, or avoid having a repetition of something that's happened to you later on. It'll help you stay healthier and have a better life rather than becoming your whole life.
So avoiding flare-ups. The number one thing that we always say is do not smoke. If you're a smoker, try not to smoke, try to quit. And then stay away from places where people are smoking. Inhaling smoke is not natural. Our body tries to fight it. That's why we cough, and that can cause a flare-up. Stay away from people who are sick with a cold, sore throat, flu, or pneumonia. Also, children, if you have kids or grandkids, especially if they're in preschool, the younger ages, they constantly have the sniffles and sneezing and coughing. Speak to your doctor about getting the flu and pneumonia vaccine, and try not to sit in traffic too much. Exhaust fumes can cause irritations, and it can be worse. It can cause worse symptoms and effects. And then try not to go outside if there are air pollutants, like air pollution alerts, smoke fires, forest fires, and marsh fires. Any type of environmental pollutants that have been known to cause you flare ups, or you think might cause flare ups.
That's right.
So also in cold weather, cover your mouth and nose with a scarf or a mask. Try to breathe through your nose, because breathing in through your nose will help moisten and humidify the air. And now a lot of people still wear masks. So if you do have a simple face mask that you had for COVID and it's cold outside, wear the mask because it will help warm up the air as you breathe it in. And then some people, the hot and humid weather affects them. So stay indoors, try to stay in an air conditioned room. Don't breathe in fumes from perfumes, paint, or cleaning products. If you have some work going on in your house, ask the people that are working, hey, I've got some lung issues. Can you please use the low fume paint? Cleaning solution, paint stripper is a big one. So try to see if you can get low fumes chemicals that you're using for all types of activities. And then learn ways to relax and manage stress. Try deep breathing or yoga, and we'll go over the pursed breathing again.
Right. And some of these suggestions come from research, but a lot of them, including the ones that have been researched, come from people that are living with chronic lung disease. These are tips that people have followed and that have worked and that we've learned from. They're practical and can really help, and we know that they often do, most often.
So when flare-ups happen, know your pattern and have a plan. So I always refer to it as escape plan. It's not really an escape plan, but it sort of is, right? Try to get away from the irritant. If somebody starts lighting up a cigarette, try to leave the room, leave the restaurant, whatever it is, uh, and get away from that irritant. Same thing with a cat. If you see a cat running around and you're like, uh-oh, try to leave. Take your rescue medications as ordered by your physician. So keep your rescue inhalers with you, or if you have like a portable nebulizer with you, have that with you in case you end up in a situation where you have a flare up and you're gonna need it. Clean your airways according to your plan. The huff cough or a device, if you have one, up to 4 times a day. So it could be an acapella, a flutter valve, and other types of devices. And then perform pursed breathing exercise to help reduce your shortness of breath. So we have it listed out here in the steps, but these steps are just general guidelines. Really, what's most comfortable for you is what you should do. And really, you sit up straight, you breathe in slowly through your nose, and then you exhale out through your mouth when your lips are pursed, like you're trying to blow out a candle or blow a feather across the table, and try to do it nice and slow and controlled, and then repeat as needed. That just helps smooth your breathing down, slow it down, and then it creates a little bit of back pressure in your lungs that helps give you more oxygen into your blood.
Right. So if you are someone with a chronic lung disease, you probably do know what your irritants are. So know your pattern, what has happened before. Sometimes things change and you have to revise them. Uh, you might have been keeping a diary or at least some of the time, but have it in your head anyway, and a plan that you have worked out with your doctor, whether it's written down or you just know it and share it. So you're ready for whatever comes.
When to seek medical attention. When you are getting a bad cold or chest infection, when there's change in the production of your mucus, whether it's also if it's yellow or green. So if there's more mucus, or if the color changes significantly. And then when you're using more puffs of your rescue inhalers than normal, also your nebulizers. Sometimes you'll use the nebulizer as rescue as well, because the physician can order it like as needed, like PRN treatment. So if you're using that a lot more, that's also a sign. When you feel like your medicine is not working as well as it normally does, when you have having a very hard time breathing, so you're really short of breath, you're coughing up blood, and then when you have sudden shortness of breath with or without chest pain.
Right. Almost all of us hate to bother the doctor or maybe be put on hold for a while or wait in a waiting room for attention. But if you need it, it's better to get it sooner than later. You're less likely to end up in the hospital. You're likely to get better quicker with less medical attention.
So, in summary, begin to think about what your irritants are that can cause your chronic lung disease to flare up. It can be helpful to keep a diary of your flare-ups and share it with your physician or your other provider. When possible, avoid the irritants that cause your respiratory condition to flare up. If you know you're going to be somewhere that you can't avoid, try to pre-medicate. Seek medical attention when needed. Do not wait until it's too late. Can't stress that enough. Avoid people who are sick and stay away from crowds during flu season. And if possible, get your flu and or pneumonia shot or COVID vaccine.
Right.
Thank you very much for listening to our presentation. We really appreciate it.
Right. I also want to thank you, and I want to say that this should be helpful to folks with chronic lung disease, whether that's you or somebody that you love and possibly are helping with their care. This is should be practical advice, and we wish you the best possible health.
Thanks again for listening to the presentation. For any more information about our pulmonary rehab program or about Morlen Health, please go to morlenhealth.com. Thank you so much.
Bye-bye.